Hi everyone, welcome to 4x11. Today we are going to go through a few important spotters from Abdominal Radiology section. It would be a quick discussion, so let's begin. This is the first case for today. X-ray of abdomen. What do you think is the diagnosis? Focus on right upper quadrant. So this was a case of porcelain gallbladder. The X-ray is showing calcified wall of the gallbladder. Let's move on to the second case now. This is second case for today. CT scan image is shown focusing on the liver. What do you see here? What does the arrow represent? This was a case of Caroli's disease. Multiple cysts are seen within the liver. An important finding is the hyperdense dot that is seen within the cysts, which represents portal vein branch. Okay, so this is the next case. A coronal CT section is provided showing some calcification along the peritoneal surfaces. What do you think it is? This was actually a case of encapsulating peritoneal sclerosis, also called as abdominal cocoon. We can see widespread thickening and calcinosis of peritoneal reflections. This disease entity is one of the complications of peritoneal dialysis, something to remember. So this case has history of cachexia. What do we see? Ascites along with scalloping of liver margins. In what disease entity do we see such picture? Ascites with scalloping of liver margins is classically described in cases of peritoneal carcinomatosis, and it was the case here. So let's move to next one. A chest X-ray this time, but we were supposed to discuss abdomen spotters. Okay, look below the diaphragm then. What do we see there? Air is seen below the right hemidiaphragm, so it is pneumoperitoneum. Well, no, it is not. This is a case of Chilaiditi syndrome where there is interposition of air-filled colon between the undersurface of diaphragm and liver, give a fake appearance of pneumoperitoneum. This is another CT section from abdomen. What's the diagnosis here? We see some defect on the left side with herniation of bowel loop. This was a case of Spigelian hernia. Spigelian hernia is a type of ventral hernia in which the defect is along the semilunar line. Let's see the next case now. It's an ultrasound image showing liver and kidney, but kidney looks a bit different. The medullary pyramids appear hyperechoic. This was a case of medullary nephrocalcinosis showing the classical hyperechoic medulla. Remember this image. Okay, the next patient presented with history of right upper quadrant pain and jaundice. The CT was done and showed the following finding. We see the gallbladder wall is thickened with hypodense intramural nodules. No obvious infiltration is seen in the liver. This was a case of xanthogranulomatous cholecystitis. It is usually seen in elderly patients, and carcinoma is a close differential. So here is the next case. Patient is a case of right failure. We see heterogeneous mottled appearance of liver with reticulated pattern. Also, the inferior vena cava appears prominent. The given findings represent nutmeg liver or chronic venous congestion of liver due to the back pressure changes due to right heart failure. So this is the last case for today. A patient presented with acute abdominal pain. CT was done. What do we see here in the CT? Some form of fat stranding is seen anterior to the ascending colon. This was a case of omental infarct, and this is classical appearance of it. It's basically fat necrosis and appears as fat stranding. Thank you guys. This was all for today. Have a good day.